Today, we're tackling something you've probably heard of, a kidney infection, but we're going deep on its proper name, acute pyelonephritis. And trust me, it's way more than just a simple UTI. This is a serious condition where bacteria actually invade the kidney itself, and understanding how it all works is absolutely key to fighting it. So let's break it down.
Here's our game plan. We're going to start with a solid definition and then get a sense of just how big this problem really is. After that, we'll follow the bacteria on their journey up into the kidneys, see how doctors classify these infections, which is changing by the way, and then walk through the modern strategy for treating it. We'll wrap up by looking at the very real risks and complications.
Okay, so first things first, what exactly are we talking about when we say acute pyelonephritis? Let's get the official clinical definition straight. Now, this is the key distinction right here. We're not talking about a regular bladder infection, which is called cystitis. Pyelonephritis means the bacteria have done something much more impressive and dangerous. They've traveled up the urinary tract and are now infecting the actual functional tissue of the kidney. It's an upper UTI, and that's exactly why it's such a bigger deal. So just how big of a problem is this really? Well, when you look at the numbers, you start to understand the sheer scale of the battlefield that clinicians are facing every single day. It's a major public health issue. Get a load of this number. Over 400 million cases of UTIs around the globe every single year. Now, of course, not all of these become pyelonephritis, but this is the giant ocean from which these more serious kidney infections emerge. This isn't some rare disease. It's a massive worldwide health burden.
And to bring it a little closer to home, look at this. In the US alone, over 200,000 people get sick enough from this kidney infection that they have to be admitted to the hospital every year. Think about that. The number of hospital beds, the resources, the cost. It's significant.
So who's most likely to get this? As you can see, certain groups are definitely more vulnerable. For young women, a lot of it comes down to anatomy. For pregnant women, hormones can actually cause the ureters, those are the tubes leading from the bladder to the kidneys, to widen, basically giving bacteria an easier path to climb. In kids, sometimes a condition where urine flows backward is the culprit. And of course, in any hospital setting, catheters can unfortunately act as a direct highway for infection. And hey, this is a global problem, for sure. This data from Indonesia is pretty staggering. In some of their major hospitals, UTIs are responsible for 30 to 40% of all infections that people get while they're in the hospital. It just goes to show what a universal challenge this is. All right, now for what I think is the most fascinating part. How do these bacteria actually pull off this invasion? Let's trace their journey, step by step, from the outside world all the way into the delicate tissues of the kidney. Here is the most crucial thing to understand. In about 95% of cases, the problem doesn't start in the kidney. It's an ascending invasion. The infection starts low and climbs high. Let's break down the 4 stages of this upward assault. It all begins with colonization, usually from bacteria that live harmlessly in our own gut, like E. coli. Step 2. They find their way into the urethra and start multiplying in the bladder, causing that classic bladder infection. But step 3 is the real trick, ascension. They manage to travel up the ureters, fighting against the downward flow of urine. And finally, step 4, invasion. They reach the kidney, latch on, and trigger that massive inflammatory response that causes all the severe symptoms of pyelonephritis. Okay, so a patient comes in, they're feeling awful. How do doctors classify the infection to figure out the absolute best way to treat it? Well, this is where things have gotten really interesting because there's a major paradigm shift happening with the new 2025 guidelines. So traditionally, the line was drawn based on the patient's profile. Uncomplicated was a term reserved pretty much exclusively for healthy, non-pregnant women with a perfectly normal urinary tract. Literally everyone else, men, pregnant women, people with kidney stones or diabetes, they all got lumped into the complicated bucket. But that way of thinking is changing. And this right here is the game changer. The new guidelines are basically saying, hey, let's stop focusing so much on who the patient is and start focusing on what the infection is actually doing. If you've got systemic signs, like a fever, chills, that deep pain in your side, that's evidence the infection has invaded the kidney tissue. And under this new framework, that automatically makes it a complicated UTI, or CUTI, and that demands a much more aggressive approach. So this new way of classifying pyelonephritis has huge implications for how it's treated. How do doctors manage these infections now? Well, there's a modern four-step strategy that's all about making smart choices right from the start. To pick that all-important first antibiotic, clinicians basically run through this mental checklist. Step 1. How sick is this person? Are we worried about sepsis? Step 2. What's their risk for antibiotic resistance? Have they taken a lot of antibiotics before? Step 3. What's unique about this patient? Any allergies, kidney issues? Are they pregnant? And finally, step 4, especially for severe cases, they consult the local antibiotogram. It's like a map of what bacteria are causing trouble in their area and which drugs are still effective against them. And this gives you a little peek into the antibiotic toolbox. You can see the different classes, from fluoroquinolones to cephalosporins. A doctor might start with a first-line option like ceftriaxone if the patient isn't critically ill and their resistance risk is low. But if the situation is more serious or if there's a real concern about resistance, they might reach for one of the bigger guns, a second-line option like piperacillin/tazobactam. The main takeaway here is that the choice is never random. It's always guided by that four-step assessment we just talked about.
All of this careful step-by-step management is for a very good reason. So let's talk about the stakes. What happens if this infection isn't treated quickly and effectively?
The consequences can be really severe. The infection can literally wall itself off and form an abscess, a pocket of pus inside the kidney. It can spill out into the bloodstream, causing sepsis, which is a life-threatening medical emergency. Over time, repeated infections can cause permanent scarring on the kidneys, which can contribute to chronic kidney disease down the road. And for pregnant women, it's a known trigger for premature labor.
And that brings us to the final and most critical question. We have the guidelines, we have the antibiotics, but the bacteria are constantly evolving, constantly getting smarter. The battle against pyelonephritis is increasingly becoming a battle against antibiotic resistance. So the real challenge for the future is, how do we stay one step ahead? It's a question that requires vigilance from everyone, from doctors to patients to policymakers. Thanks so much for watching.